is Dr. Thomas McGinn from Common Spirit Health. Thank you so much for joining us. And, as we put this number out there, it's one of those things, you hear the word grim or unfathomable, but it is kind of hard to wrap your head around a number of 500,000 deaths in our country, because you think of the lives behind it. Or I don't know if you saw the New York Times yesterday, and what that looked like. But for people at home, you were here in the tri-state area at the height of the pandemic, and now, dealing with, the cases across the country where you've seen them spike. What does that number mean to you?
Yeah, it's just heart-rending, and I think part of it is understanding the intimacy of those numbers. I saw families in ICUs and COVID units, in the hallways crying because they couldn't be with their patients. Their family members. I've had colleagues that I've lost personally. And we've all, been touched by this. So I think sometimes the enormity of the number makes it hard to wrap your head around. But then when you think about those intimate, moments where someone that you've lost, or you saw someone lose somebody, then you try to multiply that across 500,000. It's mind-boggling. I think as someone that's been involved in this from the very beginning, first on the East Coast and then changed my position and moved across the country, I wonder sometimes also, how could we have done this better? And that, makes me reflect on where did we go wrong? What could we do better? And continue to think like that. So that's really, my head is often, well, how could I have done a better job?
Yeah, and it's funny when you say that, because I think back to the beginning of our conversations, and when we were looking at 100,000 and thinking like, is this some dire prediction? And now to see where we are a year later, it seems so much larger than we ever thought it would be.
Yeah, no, I think I remember in New York in the summertime, we got to these very low numbers, and I thought, okay, we're coming out of this, we're going to be fine. And then suddenly we had the uptick, and we saw what happened in LA, and then, across the country, it just took off, and then came back to New York. It's humbling, really, to think about it. And we all talked about a marathon. We thought the marathon was going from March to like August.
Mm-hmm.
And the lesson showed us, if you go back to the pandemic of 1918, that this went on for a couple of years, and we thought somehow, this was just going to be a quick run and a few months through it. But it's been a marathon. But we're coming through it. I think I've been on the flip side of it. I've been very proud. Was jogging in Central Park over the weekend. Everybody had their masks on, and someone slipped and fell, and everybody picked them up, and there was joking about the pandemic, and people are resilient. So I'm confident we're going to have a good summer.